Colorectal cancer is one of the most common conditions affecting Australians, and over their lifetime, around 1 in 20 Australians will suffer from bowel cancer. Many cancers are screened for in Australia, but screening for bowel cancer is probably the most important of these because it affects large numbers of both men and women and is highly preventable and treatable if picked up early.
Bowel cancer screening has been demonstrated to save lives, and so some years ago now, the Australian Federal Government formed the National Bowel Cancer Screening Program. It's been very effective, but the current COVID pandemic has resulted in incredible lifestyle changes for all Australians, and many people are struggling with the concept of what to do with their bowel cancer screening and whether to participate in screening during the pandemic. This presentation is designed for both patients and for doctors to offer some guidance in relation to how to deal with bowel cancer screening and patients with bowel symptoms during the COVID pandemic.
The first group of patients to consider are those who have significant symptoms from their bowel. These include rectal bleeding, persistent change in bowel habit, unusual or unexpected abdominal pain, or unexpected weight loss. Regardless of age, all of those patients with symptoms should be either consulting with their general practitioner or specialist to discuss strategies for investigation. For patients with symptoms, without doubt, the very small risk of being exposed to COVID during a medical consultation or test is completely outweighed by the benefit in ensuring that there is no sinister cause for the symptoms. So all symptomatic patients should see their doctor.
Not all of these patients will require colonoscopy, but by seeing a doctor, you have the opportunity to be properly assessed and guided as to which of these investigations are needed. The appropriate investigations may vary depending upon the prevalence of COVID-19 in the community at that time. As an example, whilst levels are low, colonoscopy is available for all patients with symptoms and has been conducted with social distancing and protection for patients and medical and nursing staff. The risk in a low prevalence environment is minuscule, and we encourage all patients to discuss the need for colonoscopy and the COVID risk at that time with the endoscopist to help them make an appropriate informed decision about timing of investigations for you.
The National Bowel Cancer Screening Program is designed for patients who currently don't have symptoms and is aimed at the early detection of precancerous polyps or bowel cancer in patients without any symptoms. The vast majority of Australians can get by with screening for bowel cancer by the use of the faecal occult blood testing program. Faecal occult blood testing is a very straightforward test that you can perform in the convenience of your own home. The patient has a bowel action into the toilet, takes a small sample of the water from next to the faeces, using a brush places it on the slide, and then sends the specimen off in the mail. Faecal occult blood testing is designed for patients who don't have a significant family history of bowel cancer, who don't have any symptoms, and are between the ages of 50 and 74, although it can be considered in patients outside this age range. It is safe, straightforward, cheap, carries no risk, and can be performed at home. So if you've been advised to undertake faecal occult blood testing, there is no need for you to defer this investigation during the COVID crisis. And our strong advice would be to continue on your time when the test is due. If you do return a positive result, or if you have current symptoms, make sure you discuss this properly with your general practitioner or specialist.
Colonoscopy is only required for patients who have significant symptoms, or who have a strong family history, or who have themselves had significant polyps or a bowel cancer. The National Health and Medical Research Council has clear guidelines as to which patients are suitable for colonoscopy and which patients are suitable for faecal occult blood testing, and you should discuss this strategy carefully with your general practitioner or specialist. For patients who do require colonoscopy, the vast majority of them can be done and safely proceeded with during the COVID pandemic. As of early May 2020, there are still some restrictions on the number of colonoscopies and semi-elective procedures that can be performed in Australia. So if the situation is relatively low risk, or if you are at particularly high risk of COVID, it may be reasonable to perform a faecal occult blood test in the immediate future and perhaps defer a colonoscopy until later in the year. However, the safe thing to do is to have a clear discussion between the patient and the treating physician to discuss with each patient their need for investigation or screening and the timing of this with respect to the risks of COVID-19 and the risks of delays in diagnosis. For all patients with symptoms, investigation should proceed as soon as practical.
Australia's done a fantastic job of dealing with the COVID pandemic. It is equally important for all patients to make sure that they care for all aspects of their health, and you should have a clear strategy in place worked out between you and your doctor as how to continue your screenings.
To summarise, for patients for whom faecal occult blood testing is recommended, we suggest that you go ahead with this testing forthwith when your test is due.
For those patients who require colonoscopy, it is safe to go ahead during the pandemic, but if local conditions lead to a delay in you having your scope, you should discuss your options with your general practitioner or specialist, and perhaps consider faecal occult blood testing while you're waiting for your colonoscopy.